Karibu sana, this is Morning Cafe. Good to have you, and I hope that you're having a very great morning. Quite chilly right here in Nairobi County. I don't know how it is where you are. We are discussing matters health because it's a Monday, and today we're joined by not a new face, Dr. Victor Ngani. He's a medical director at Jalram Hospital, and he'll be helping us understand what we call the old people disease. So mostly we refer to it as that. But over the years and recent years, we've got to have new cases of arthritis in young people as young as 20. What's happening here? Doctor will be helping us understand this. And this is one of those places and platforms that you can always chime in. We love to hear your voice on these conversations that we have. 0795 045 864 is the number. You'll be seeing that number down your screen. Save it right now because you'll need it. In case you have any questions, any kind of questions regarding arthritis, for you, for your loved one, you really want to clear the air when it comes to arthritis, hiyo uchungu yote unasikianga kwa joints, how and where does it come from? Doctor will help us understand. On WhatsApp, 0793 267 279 is our WhatsApp number. If you want to text us on SMS, 22047. You could also head into our Facebook pages at TV47KE. Doctor, good to have you once more.
Thank you, Stanley.
I'm pretty sure some might be seeing you for today for the first time. You can give us a brief intro of who you are before we get into this conversation.
Just very briefly, Stanley, my name is Dr. Victor Ngani. I'm a medical doctor in Kenya now for close to 16 years approximately. I've been in different areas, critical care, but most recently I've been in healthcare management, different spaces there as well. Right now I work for Dr. Asik Kantere Jalaram Medical Services in Westlands as a medical director. But of course I've done other things relating to in the public healthcare space, labor space for doctors, yeah, things like that.
Right. You definitely also mentioned an avid chess player, but that's for another day.
Yes.
We have these images here on our screens, and they'll help us understand what these are. From what I can see, these are different joints in different parts of the body. In my biology, I remember being told about 350 thereabout joints. Some say 360, some give different numbers. Even before we get into, because the conversation really is for arthritis, is about joints. How many joints are there in the body?
That's a trick question. I probably have to remember the exact number. I'll not give you that off the top of my head. My areas, well...
An average of, give us an average.
Approximately, the ballpark that you've given. That's where it is. That's where the number is. Yeah.
Why is there variations?
So, to be honest, I've not paid attention to that particular question because when it comes to arthritis, that doesn't really matter much. Yeah, that's a question that I really should have prepared for, but it's not something I really pay attention to at this juncture, at this moment.
All right, I just wanted to clear the air on that so that we also understand. Because, I mean, if you say 360 thereabout joints, that means there's so many joints. So even for medical professional, how do you break down this is a specific joint? Okay, fine, there's the number of joints, but then help us understand the different types of joints. Does that come in play when you talk about arthritis, the types of joints that there are?
Yeah, it does actually, and I'd categorize them very broadly into the large joints and the small joints. And every place where you have a bone connecting to bone, where you're supposed to have some form of movement. You see, bone tends to be very rigid. It's like a straight, it can't move. So at any place where your body needs to move for the purpose of function, then you have to have a kind of connection between the bones that allows for movement. And this is where then you have a joint. And joint is basically something sort of, can I say, call it a relatively weak point within your skeletal structure to allow for movement within the body. And that allows you to achieve, say for example, you want to fold your arm, that happens around a joint. And there are many areas. The big joints, then you'll talk about the hips, the knees, you'll see the elbows and the shoulders, but you actually have joints as far back, Stanley, in your spine. So between each and every one of your you know, if you've looked at a picture of a backbone,
Yeah.
I don't know that you have that here, then between the two areas, you'll actually find there's a joint. So there's a joint in between those small vertebrae. You have joints between the fingers. At every point where your finger is moving, there's a joint there as well. Yeah.
Right. From what you understand, when you say arthritis, unaambiwa shosho yako na arthritis, unajua hiyo ni uchungu ya joint. These joints that you're now explaining to us, the ones that we can now see in different parts of the body. Is there more to it? Is there more to just ni uchungu ya joints?
Definitely. So arthritis is a very big word. So in medicine, because it's based on foreign languages, often Latin, we take the Latin word for a particular point. In this case, anything you hear about arthro, that refers to joints. And whenever you hear anything about itis, it is inflammation.
Okay.
So you'll talk about gastritis, gastro is the stomach, itis is inflammation. So arthritis is inflammation of the joints. And unlike the picture we have of bones, which is that they are dead sort of, in living tissues, bones are actually living tissues. They actually can get hurt, they can get bruised. So inflammation is anything that causes the joints to be a little bit, well, they can swell, they produce a lot of fluid, and certain areas can be eroded. Now, there are different types of arthritis that can then cause, what can I say, can cause our joints to be not normal. Some form of injury, small scale, big scale, or just wear and tear. And all these things will cause inflammation, that will cause pain, will cause swelling, and sometimes even redness. Yeah.
Wait, so an injury can now make you have arthritis?
Yes, definitely, an injury to the joint. So we'll discuss different types of arthritis, how they come about. But in essence, all these types of arthritis, what they have in common is there's some form of injury to the joint. So injury can be, yes, someone has knocked you. But you can also talk about injury to the joint from illness, that you have an infection, or you have an accumulation of something like in gout, and those accumulations damage the joint. This is what I'm referring to as injury. And that injury causes the joint to be not normal. There'll be some inflammation, there's some bruising. Right. Whenever you have injury to any part of your body, there's a bit of swelling, some fluid is removed, and that causes pain. So those three things collectively then constitute what would present as arthritis in a patient. Right.
When in medicine, I understand that when you say there are many variations and many types, there's always some common types of something that would affect a certain populace. In Kenya, for example, most hospitals would see patients in specific types of arthritis, for example. In your experience for the many years, which are some of these common types that the viewer needs to understand this morning?
The most common type of arthritis is called osteoarthritis. And osteoarthritis is what people tend to refer to as old man's disease. And osteoarthritis is basically the arthritis that comes about from wear and tear. You see, from the time you're born, Stanley, you're moving your joints through and through. You're moving your joints hundreds of thousands of times every year. Those are really fantastic joints. The same thing with any mechanical joint you have out there. People are nowadays making foldable screens, and they say they've tested them for 200,000, 300,000 joints. But your joint actually moves for hundreds of thousands of times every year. And when you do that, over time, it's not as smooth as it was before. Maybe I need to describe some mechanism in the joint to understand what's going on. So you have bone, which is generally a little bit rough. But then at the joint space, there's another bit of soft bone that is covering the hard bone itself. And this is sort of, think of it like grease that makes movement very easy. And it's very slippery, it's quite smooth, a little bit spongy, so that when you move, then you don't have a lot of pain, there's not much friction, and sometimes it acts as a shock absorber. That if something hits, then there's something to absorb that. If have you eaten chicken?
Yes, I was actually now to give you that analogy.
That analogy?
Yes.
So there's this, okay, which tribe eats kuku just before the Luas? Because the Luas eat the top part. Okay, on a light note, but there's that white bone. When you're eating, say for example, the drumstick, you see that there's what looks like cartilage.
Which is very soft.
Which is very soft. Yeah. That is the grease. That is the shock absorber. That is the surface that maintains, makes it frictionless, makes it very smooth. But that particular area can be damaged. If it's damaged, then the underlying bone, the red part, becomes exposed. And so if at any point the bone is meeting bone, that can be extremely painful. In fact, even if you have sometimes just imbalance in this bone, it can make the bone a bit abnormal. And because there's some lining of the bone itself, then that lining can begin to produce fluid. Then there's excess fluid in the joint space, which causes swelling and causes pain. And something else that happens, every joint has a bit of a lining. It's called a capsule. That capsule covers the joint, and it's like sort of a container for the entire joint. And it's supposed to be a bit flexible so the joint can move. But over time, with this kind of injuries, then this capsule also becomes a bit stiff. So when this stiffness happens, then it makes the movement of the joint difficult, increases pain, and reduces the ability of the joint to move flexibly. So you've spoken about arthritis, osteoarthritis, which is the most common type, and this is what happens with age. So the cartilage wears off, the bone becomes imbalanced, bone begins to meet bone, and you get to have extensive pain. At
what age?
So it varies. Above the age of 65, half the population above the age of 65 have osteoarthritis. Between the age of 40 and 65, about 30% of the population have osteoarthritis. Currently, we estimate about 500 million people globally, 500 million, have osteoarthritis. It's not so common in the early ages. In the early ages, we have different types of arthritis, which I'm going to come to. So that is osteoarthritis, something that you probably will hear about. Is the most common type. It's fairly easy to diagnose, but can be very problematic to address. We'll come to that. The other type of arthritis you hear about is rheumatoid arthritis. Rheumatoid arthritis is a situation where the body has this immune system. The immune system is what clears diseases. You get something foreign in your body organizes its army, the army attacks it and removes it. Now in rheumatoid arthritis, for some reason, your body confuses the lining cells of your joint to be a foreign body. So it begins to attack it and damages that. And that damage then causes the joint to swell, and this swelling, the same process. The joint is injured, there's damage to it, and this can occur much earlier. So that is rheumatoid arthritis. There is a very common type of arthritis in children, young people. It affects about 1 child in 1,000. It's called idiopathic juvenile arthritis, big words, but basically it means that we as doctors don't know exactly what causes it. Juvenile affects young people. And what happens, again, the same thing. There's an immune process related to that, where the body begins to attack some of the cells thereabout.
Does the whole immune system, does it have in relation to genetics?
The immune system, yes. Anytime you hear something to do with the immune system, genetics actually play a role. In fact, even in osteoarthritis, there are some genetic processes that predispose someone to developing arthritis. You see, we speak about 50% of the population that gets above 65 that has osteoarthritis. So in that situation, then you would have that genetic component, but more in the immune side. You've heard of gout, and gout is basically accumulation of uric acid in the joints, and that can cause tremendous pain, damage to joints, pretty significant, very common as well. But this also occurs much later in life.
Where does this acid come from?
What acid? Uric acid. It's basically the production. It's the result of metabolic processes that results in those deposits. And if your diet is very rich in, say, meat and seafood, then the likelihood of having higher uric acid levels is pretty high. But it also depends on an imbalance in your body between production and removal and deposits. So gout is a very common issue as well, something that can then get into your joints and cause tremendous pain and damage the joints and cause arthritis. Direct trauma, so you're involved in high impact sports, jumping from heights. Physical sports are good for keeping the joints healthy, but if there's trauma to those joints, then those also become problematic issues. So these are some of the common types of arthritis that you'd come across.
On that bit of high sporting activities, for example, I'd really want to stick on that. And I'd want to try that on the kind of physical activities that people normally do. If it's farming, most of those physical activities engage a lot of joints because at the end of the day, tunaita kazi ya mkono.
Yeah.
So kazi ya mkono involves your hand and generally your entire physical body. You're going to be bending a lot. You're going to be using either your hands for screwing, stuff and all that, or if it's for the sporting activities, for, let's say, long distance runners, for the knees as well. And as you're telling us, they might really be highly susceptible to getting some of this, if it's pain on the joints and maybe wear and tear on, let's say, magoti. So after how long does it, for example, this is someone who is in their late 20s, for example. They are, he or she is a long distance runner. And they start having some of this pain in the joints. Does it mean that immediately they have arthritis, or does it now build up late in life?
Mm-hmm. So I want to be very clear.
Late 30s, mm-hmm. So that it starts developing?
Mm-hmm. So I want to be very, very clear about something. Mm-hmm. Activity is generally very good for your joints. Okay. In fact, when you have arthritis, one of the key things you want to do is maintain activity. Okay. So because what that does is it strengthens the muscles, mm-hmm. and then allows the capsule I spoke about for it to continue to move. If you become less mobile, that capsule tends to stiffen. And in reality, if you stay still for a very long time, then over time the joint becomes stiff and stiff. And that stiffness is another factor in arthritis that you really don't want. And in general, physical activity is fantastic.
What's the line that this is physical activity, mm-hmm. and then now this is way too much physical activity?
Mm-hmm. Not too much physical activity, mm-hmm. but high impact.
impact,
Things like then bump makes your joint bump. So for example, yes, someone can argue that if you're constantly knocking your leg on the ground from if you have a particular running style that causes you to stamp firmly, then those can be risking your joints and stuff like this. If you're jumping from heights, those kinds of things, parkour kind of processes, those things will be high impact on your joints. But routine work like light jogging, being in the shamba, those things actually are very, very good standing for your joints. Mm-hmm. Yeah.
So now,
okay. Now, nonetheless, if you're in sporting activity, that's high impact, and then you suddenly have injuries. Now, there are different types of injuries. You can have immediately something like a tear. Let me call it. Let me say a meniscus. This cartilage has a certain shape. There's a groove, for example, in the knee, and you can tear that immediately. That is damaged. That joint has an issue. But then the changes that would then be referred to as arthritis, this take several years, mm-hmm. because the joint is no longer, since it had some damage, then the load balancing is not as good. The balance of the weight on the body is not as good as it was before. So the wear and tear is not natural. And so over time, it ages faster than it would have because of the trauma that it suffered. Mm-hmm. What's a very good example? If you have a house that is slanting a little bit, mm-hmm. then weight comes down on one side, mm-hmm. and the risk of collapse is much higher. The same thing with your bone. Mm-hmm. If you have injury on one side, then the balance isn't normal. There's disproportionate weight on that one area, mm-hmm. and the wear and tear is not natural. It's faster, but this normally takes time, several years.
So if that is corrected in the initial years, will it reduce
the risk goes down? Definitely.
Now?
If you correct it, the risk goes down tremendously. This is why if you're an athlete and you have, for example, knee injuries, you need to get it sorted out. And you've seen this. If you watch the Premier League, then you see someone gets knee injury. They have extensive procedures, and they're out for several months, mm-hmm. until that heals very well. And they have follow-up MRIs to see. And again, it's an important point, Stanley, because if you have an injury in a high school game, it's not enough to just wait for it to heal. Have it assessed, and it can have a big impact in future.
Mostly, you'd have that, let's say, high impact. You maybe fell down, or let me use the example of boda accidents, which really happen a lot in the country. And mtu alianguka na boda, anaona mimi sikuumia sana. Maybe it was just a fracture, alienda akaekewa the plaster, mm-hmm. that was it. Mm-hmm. And later on, they now start having those pains. So where I'm really heading to this is, what are some of these red flags that you should be looking at so that I really need to see a medic?
Any fracture that involves a joint, 100% you must see a medic. Any injury where your joint is swollen and your joint is not normal, you really have to see a doctor, because the impact may seem small at that time, but the damage to that joint becomes significant. And you've seen people who've had fractures early on, and for some reason they can't use their hands or their legs anymore, because the correction of that particular fracture didn't pay attention to the joints, and joints are very important. So over time you lose function, and as a result you sort of acquire a disability that could have been corrected at the time of injury. So there's a very simple rule to that. Any injury that affects a joint, or if you've suffered trauma of any kind, and as a result one of your joints you're feeling pain, and you don't have to remember all the 300 plus joints that Stanley is referring to. You have to remember the places where you're moving. For example, if at any point there's a joint there, you don't have to see it, you don't have a need an x-ray. If you're moving your thumb like this, there's a joint there, there's a joint at this level. At any point where there's movement, I also need to mention, and these people tend to forget, that along your backbone there are very many joints, and each of those joints has an impact, and it's a very important one. Yeah.
All right. Remember, you could always be part of this conversation. 0795 045 864 tupige simu credit, and Daktari will be answering either your questions or feedback concerning this. You maybe know someone back huko nyumbani mwenye amesumbukana sana na arthritis, and you really want to clear the air and understand hii arthritis, hii chungu ya joints ni nini, what can I do to even help. 0795 045 864. That number should be down on your screens to pigia simu. You can also text us on WhatsApp 0793 267 279. 22047 is also our SMS number. We'll be taking a look at all this so that Daktari also helps you. Daktari, the World Health Organization says that it's most common in knees, hips, spine, and hands. Why is that?
Because these are your most commonly used joints. You think about it, like if you've understood that a joint is any place where there is movement, then you can just imagine the kind of movements that occur most routinely. Your hands are using this all the time. Even now in this conversation, I'm fairly sitting still, but my hands are constantly moving. The knees as well, the knees pretty much carry most of your weight. So a lot of your weight comes to the knee, the hips as well, and the spine basically supports your entire structure. So these are the most commonly used joints, and these are the joints that, apart from the hands, that actually bear a lot of weight and a lot of structure. Then in terms of injuries, these joints are also most susceptible to any kind of injury that will occur. Yeah, but these are by far the most commonly affected joints.
Right. And right now in a duration where a number of people are doing whatever you're doing right now. Sit, they have an 8 to 5 job, they come into the office and sit down. When they're at home, they'll also have that particular posture. Does this affect you, and will you be more susceptible to getting arthritis later on in your life when you maintain a certain posture in front of, I mean, there's, let's say, a computer, laptop in front of you, and you maintain a certain posture for a very long time in your life?
Yes, and in 3 ways when you talk about the computer. So the first way is you're inactive. Inactivity is the enemy of the joints. It makes your joints weak. Weakness is another factor in arthritis, and it creates a vicious cycle. So what you need to do is to ensure that you're actually active, because around the joint there are muscles and ligaments, and this can act as a support structure. Around any joint that you'd hear about, there's a support structure. When you are constantly sitting, then this support structure becomes weak. And when it's weak, what does that mean? It means that at the point of activity, the joint bears more weight. As opposed to, think about it, if you have muscles around a joint, these muscles are strong, then there's less weight being borne by the joint itself. But once these become weak, then all the pressure in that joint goes to the joint directly without any form of support. So that's the first thing. The second thing is that posture itself is quite significant. And especially if you're sitting on seats for a long time that doesn't have a certain support structure. The spine has its own natural curvature. And towards the back of the spine, there's a small, gentle curve going towards the tummy. And you'll see that most seats actually don't have that. So even the way I'm sitting now, you'd feel that I'm arching backwards, and that's very unnatural. As a result of that, the bone, the stress on the bone is a little bit more, and the curvature is a little bit unnatural, and definitely that predisposes you to a form of arthritis. Now again, I should mention this, for the spine, we tend to speak about spondylosis or spondylitis, but it's the same thing, basically arthritis on the spine. Someone can tell you very big words, you have ankylosing spondylitis, just think about it as, you know, just affecting the spine, but it's basically arthritis. The third item that I've not spoken about relates to actually the kind of movements that we do with the hand and the mouse on the keyboard, putting a lot of pressure at this point, and that can also affect the joints of your hands as well, and that also predisposes you to arthritis. So occupation, what you do, and activity, two very important factors in arthritis.
Something tied to that, something that we always discuss here, overweight. So does this now mean that someone who is at a certain, or rather who's overweight, is more susceptible to having arthritis?
So for the third time, I'll refer to you as Dr. Stanley. Then I'll ask Dr. Stanley, what do you think? In light of what we've spoken about, think about the knee joints. What do you think is the answer to that? So it's not me saying it's you.
From my understanding, it would really be someone with a higher BMI would be more susceptible.
Of course, because you see, and not even someone, yourself, Stanley, there's a time you're still very young, so your weight remains fairly constant. So your knees, same knees, they're bearing the same weight. At some point, you become a member of parliament somewhere, you become extremely rich, you eat a lot of food, you forget about exercise, you get, and that weight is on the same knees. So the more the weight is on the knees, the higher the pressure. Activity is good, because then it reduces your BMI, reduces your weight. The opposite of that is inactivity, increases your weight. You have higher, the higher your BMI, unfortunately, the greater the pressure on your joints, especially the knees, and also even in your spine. So weight is generally, higher weight is generally not good for joints, because somebody has to do the heavy lifting, that someone is the joints, and then that increases wear and tear, makes the wear and tear happen faster.
All right, so hypothetically, I have what we've really discussed here, and I realize, nakwaga na pain flani on my hand, for example, that doesn't just go away. Maybe there was an impact some years back, something happened, so I visit you. So what do you ask me at this point? Because now where I'm really heading here is even on matters, even the pain threshold. Is my pain around 10? On a scale of 1 to 10, is it at 10? Is it at 9? And how bad is my pain at this point?
So actually, that's the funny thing. You may have, and it's good you mentioned something called pain threshold, because someone can report unbearable pain at the same level of pain that someone else will think this is like normal. So people have different pain thresholds. They respond, they report pain differently. This is called the subjective report. But the patient, this is what they feel. So you have to honor that and respect that.
Because I mean, pain is really subjective.
Yeah, I mean, it's your pain. You're the one who knows. If you tell me your pain is so bad you can't move, who am I to tell you that your pain is not so bad? And again, it's a very important. But then there's someone else who will feel the exact same level of pain. But then, for them, they don't really, That's the first thing. The second thing is, whereas you'd expect that it will always follow the severity of the illness, there are some people for whom the pain they're actually feeling the disease can be so far progressed and the pain isn't as much. Then there are those who have just a little bit of the disease is very early, but the pain is tremendous. So that varies. It may not tell you exactly 100% that this is the situation. However, when you come to me, then I'll definitely find out what kind of pain you're feeling, when does it come, because which joints are affected, is there any association, how is it in the morning, is there swelling, is there redness, have you had trauma in the past, are there people in your family who've had this kind of illness before, and does it go away, have you had it before in the past, or other associated factors, because there'll be other things that can cause joint pains that are not arthritis. Then you can have arthritis that is very gentle and happens over many years. And so by the time you're coming to me, it's been there and you think it's normal. I may even pick it up, not because you reported it, but because I was asking about something else, then we have this conversation. So that's the starting point, a proper thorough history and a proper thorough examination of the joint before we determine the next steps.
Right. Someone would also be curious, because you have the figure of the joints, mkono, the wrist, as well as for the specific for the fingers as well. And someone would be curious, first of all, does arthritis spread to other joints? Number two, if I had on this wedding ring finger, what impact will it have on this other fingers? Because I really have a lot of pain on this specific finger. So does it have an impact on my general hand?
Okay, so it depends again on the cause.
Yeah.
Remember, when you talk about osteoarthritis, it's basically physical wear and tear. So if you have, say, physical wear and tear, normally these fingers are not the most affected. Talk about the knees, for example. But I'll take this as an example to be clear. Then the wear and tear is here. You cannot transmit wear and tear to the next joint.
Okay.
Because that's a physical issue affecting this joint. For example, if someone crushed your finger and you got a lot of pain, the joint wasn't well fixed, it becomes, stiff, you cannot transmit that to the other finger. But it does 100% affect the function of the whole hand because you need this finger to function. However, if you speak about something like rheumatoid arthritis, where the body is creating an immune response against your cells, there is every possibility that when this joint is being attacked, this is also being attacked, not because this joint is causing the attack here, but because the process of attack is affecting this joint. So when you talk about psoriatic arthritis, okay, that's another kind of arthritis where it's related to a certain kind of skin illness. Again, there's an immune process related to that. Then all these factors come together. Now, it's important to note, it's very possible and very likely that when you have arthritis, even osteoarthritis on one knee, you'll have the same on the other knee. Why? Because you tend to age the same. Okay. So as much as you'll have the symptoms more pronounced on one side, there's every possibility that the other knee that doesn't seem to have anything already has some damage, because it's not as if you're standing on one knee for 40 years of your life. It was both legs most of the time, and they get affected the same.
And for something that you also mentioned for the RA, that you'd like really saying RA, which is the rheumatoid arthritis. I'd love to dig deep on that, because you say it would attack, that is the word that medics would use, attack one joint, it would also attack the other. So if, does it attack a specific part of the body, or if it was to attack let's say the hand, the wrist, it would again migrate, let's say, to the knees and the hips?
Okay, so there's a predilection. You tend to see a lot of the symptoms in rheumatoid arthritis affecting the small joints of the hands, and the hands in particular. This is the general disease process. This is what you see. But in reality, remember that the underlying process affects immune response to your synovial joints. So it doesn't exclude the other joints as well. Then the second part is, even in the what we call flare-ups, or the attacks that the attacks of pain, you may actually find that it moves from joint to joint. This season, this joint is attacked. Next season, another joint is attacked. But the process, if you are to go down and actually inspect each of these joints, you'll find some level of impact. Now, it depends on how well the disease is controlled. Then the attacks become less frequent. But in reality, the underlying process is your joints are generally susceptible.
All right. Before we continue, allow me to fill some questions thrown at us on our WhatsApp number 0793267279. You can continue filling these questions and also feedback. You can also call us live on air. Dr. will be answering your questions or feedback. 0795045864. Someone who doesn't will say their name, they say, what if my joints make noise and no swelling is seen?
Yes, if you have your joints making noise, that's a very clear sign to you that there's something wrong with your joints. It means that the normal gentle lining has been damaged and there's bone attaching on bone. You may not feel the pain, you may not even have swelling, you may not even have the stiffness. But the fact that your joint is making noise, you really need to have it evaluated. And we now have access to things like MRI. The evaluation is very, very easy. You start by seeing your doctor, have a conversation, they can advise you. But joints making noise is not normal. Joints are supposed to be quite silent in their movement.
So does that automatically scream arthritis, or now more tests definitely have to be done?
More tests have to be done, but generally that is the one thing that you have to think about. We're not saying the cause of that, but when your joints, say for example, you hear the cracking sound as you move, you're moving, you're walking and you feel every step the knees are making some cracking sound, that is definitely a reason for you to see a doctor. And the earlier you do that, the better, because as with everything, the earlier you start the interventions, the better. And when the joint is becoming a little bit damaged, you can stop that, slow down that process so that you don't need more advanced measures early in life. And remember, life is long, it's not short.
Right. Yeah. There's something you've mentioned, more advansed measures is now what I want to dive into right now, the treatment options. So this person came in and Kangalio Komwambia, this is osteoarthritis. You went through all these questions with this person, and so what kind of treatment, first of all, now from you, what kind of treatment options would you be offering this person?
It's a range, and there are two things you're looking at. The first is to address the two things that are most problematic, which is pain and loss of function. So by far the thing that brings most patients to hospital would be pain that's associated. It can be extremely painful. When bone is touching bone, that can be really difficult, and especially when it's swollen and things like this. The other thing is when you're not able to move, you feel very stiff, you can't do what you do normally, that's also problematic. So the first thing relates to pain. A lot of patients may think you need medicine right away, but in fact there is a physiotherapy process. It's called a GLAD program that can be put in place. What it does is strengthens the joint, strengthens the muscles around it, and this alone can actually be enough to reduce pain for many patients. That's the first thing that you could do. Then the next step in pain management is painkillers. And here you have to be extremely careful, because there are painkillers that are not effective, then there are painkillers that are extremely dangerous. So a good example is these drugs will be over the counter. The ibuprofen, for example, these are drugs that will relieve your pain. The diclofenac, they relieve your pain, but if you take them for a very long time, they can cause you ulcers. They can cause you to have a number of issues that you don't want, affect your kidney. So you don't want to take this routinely over long periods of time without a proper guideline. Then
some can be addictive. If you're using some pain meds,
some pain meds. If you're using opioid pain meds, yes, will be addictive, and we don't recommend that. Yeah.
No, that was what I was actually asking.
No, we do not recommend that at this juncture. There may be some pain that would require short-term opioid use, and that has to be prescription only. It has to be given by a doctor. In fact, even this long-term pain medication for something like arthritis, don't just go over the counter and buy, because yes, you can manage, and you're not treating, but the pain management is not treatment. You can manage that pain and cause yourself bigger problems that are very hard to manage over time. Then the next level would then involve things like injecting some steroids into the joint, which can relieve pain for a couple of months, and doctors are able to do this. Sometimes they can go into the joint and remove some fluid, reducing the swelling. At the same time, they can inject a certain, lubricant into the joint to improve joint function and reduce the pain as well. These are all pain management strategies. Then we come to the curative processes. Now, cure depends on the cause. When you're talking about something like rheumatoid arthritis, then we try things, drugs like disease-modifying anti-rheumatic agents. That's a very big word, but some drugs for rheumatoid arthritis. We can then have surgical procedures to correct, there's something like arthroscopy, where the surgeon puts in a small camera with some small equipment. They clear any damage, clean up the surfaces, remove any tissues that are problematic, and allow your joint to thrive, all the way to situations where you can fuse a joint. If you're having some very severe back pain, there's a way the orthopedic and neurosurgeons can actually fuse the backbone so that the movement doesn't occur. When the movement doesn't occur, then you don't have pain, because the movement between the joints doesn't exist. And then all the way now to joint replacement, which has become a very big thing. And you can,
Before tuendelee na joint replacement, nakumbushwa tunaweza mix Kiswahili pia kwa mtu mwenye kidogo some of this biological terms inamhepa. For the surgical bit, because this is now where many people ask, and how much the cost. So even before we had this conversation, I talked to a couple of people who have undergone this, and what they tell me is they'd pay for NHIF would cost 250,000.
Yeah.
Some hospitals would charge 750,000 for the surgery. So that would mean they have to add for the 250,000 NHIF.
Yeah.
Add ifikie your 750,000 thereabout, the specific surgeries that they had. In your experience, ni cost in a range wapi when it comes to surgery, and because I mean you're giving us some options of some of the surgeries, also depending on where the joints are. Help us understand this.
That's the range actually. It can be anywhere between 250,000 to 1 million shillings. That depends on where you're going and who you are seeing. And there could be a small difference in terms of the implant itself. The implant, so the artificial knee, for example, that's being put, there is a difference between the different types. And that may have a difference in terms of price. Beyond the implant, then doctors will charge you different amounts, hospitals will charge different amounts. So there are hospitals today that for the 250,000 that NHIF pays, you walk in and you walk out.
Without
extra payment.
Okay.
Then there are hospitals today where you'd walk in and you have to top up 750,000. Yeah. The choice is yours. The only place where you need to have a conversation with your doctor is the implant. Because I do not believe that only the rich person should get the better implant. The better implant should be available to everybody else. And this is where now NHIF can come in, because if you make a provision only for the cheap, less, well, it's not bad, it's good, but there's a better implant, then should we say that if you are just paid for by NHIF, you don't have access to this one? Those are conversations that we need to have.
Yeah,
but honestly, there are places today you can walk in and walk out, have the whole procedure done without any additional expense. And so that shouldn't be a factor, and I'm glad NHIF covers it. So the question of NHIF, of not being able to do it because of cost, that should not be the case anymore.
For the implant, does this person have to stay it for the rest of their life? Ama inafika mahali, a later surgery, maybe to remove it, have another one? Help us understand.
The minimum period tends to be around 10 years, and then it can be a bit longer. But again, there are many other factors. You can have the implant put in, then it's not effective, something goes wrong, it has to be removed, and something else has to be done. But in general, it goes well. You can look at probably disease-free period over 10 years and above. And remember, this is a person often is in the age of around 60 years, 50 years. So 10 years is a pretty good time. And then there are other implants that are coming in that generally give you a little bit longer, new techniques. There's a lot of progress in this sector as well.
Right.
But you can comfortably look towards pain-free. And actually, for patients who work with pain, normally they've worked with pain for like 10, 20 years.
Okay.
And this is like a miracle. The moment they get the knee replaced, the pain disappears, they're able to move. It's a pretty miraculous thing, to be honest.
There's a question here. Hey, Stanley and Doc, what if someone experiences pain when it's cold, but when they dress warmly, they feel better?
Yes, there is this, but again, if you're feeling pain in your joint, depending on circumstances, then you still need to have your joints assessed, because yes, different temperatures, for example, cold in general, increases your ability to perceive pain. Okay. So you really need to be very careful. It doesn't mean that your joint is problematic, but it also doesn't mean that your pain is not normal. So when you're feeling pain in a joint, the first thing that should hit you is, let's get this assessed. You better be safe than sorry. Let a doctor come and see you, tell you there's no problem here, or if there's a problem, find it out early. Finding out is the best thing you can do when you have a problem.
Right. That was Linda's question. Thank you, Linda, for that. I hope we may GB. Before I wanted to ask Linda's question, I wanted to understand your BTA implant, because so many viewers right now are trying to visualize how does an implant look like, the whole functionality of it. But then I want you to help us. So for example, in any of these joints that you have here, I'll pick, let's say a shoulder, for example.
Pick the knee, the hip here.
The hip. Yeah. So we have the hip, for example. So should it be fractured?
Yes, it could have been fractured at the neck, but often what happens is the hip is the one on this far end. I don't know whether I'm able to walk up here.
If you may.
Yes, please. So this is your hip joint, and this is the pelvis. Okay, this is the thigh bone coming in around the hip. So we have this area which is called the head of the femur.
Okay.
This is the neck. So, and then there's a very nice socket where it's sitting. So this is the actual joint. Okay, the whole of this is a joint, but this is where we have what is called that cartilage. This is where it's sitting. So what the orthopedic surgeon will do is they will remove this whole head. Then they will put something here artificial where it's going to articulate on. And then this whole head will also be replaced, and there'll be a stem going into your femur. Okay. So eventually you're having something made here that is touching onto this. And if you had a lot of pain from this joint, because it was damaged, it was painful, it was red, now you have a metal thing that cannot feel pain, and you have a place where it's sitting, very nice mechanical joint, and the pain goes away. Again, on the knee as well, which is that joint at the far end, a similar process can be done, and the pain just disappears immediately.
Wow, okay. Yeah. Now, on that, before I ask, because I'm seeing other questions coming in, obviously there is going to be the physical activity after surgery. Yeah. I've forgotten what medics you say on that, but then it's basically just trying to make your body remember this is how you used to walk. Yes. This is how you used to do certain physical activities before the pain, before all this. So how long does that happen?
And again, an important question. A lot of people will undergo this very expensive and extensive procedure. But that's not the end of the story.
Or physical therapy, remembered, yeah.
That's not the end of the story. After that, you really have to have a structured physiotherapy program. And it has to be specific. Not any physiotherapist can take you through the appropriate physiotherapy for your joint for the next couple of months. And so for a minimum, actually it goes all the way up to 3 months, where you're continuously working progressively with your therapist to guide you not just on how to walk, but how to make sure that the joint remains well aligned. So imagine that it has been placed properly, then you unfortunately put weight on it, then it sort of comes out of alignment. That joint is not going to serve you. It's going to become problematic. It will cause you a lot of pain, and you have to replace it in a short while. Okay. So very important, if you've had a joint replacement, please follow very critically the next steps, which is to work closely with your physiotherapist. And I've had a case where a person paid for by NHIF came for surgery with the surgeon. Then they're told, this is your program, because you normally get a written down physiotherapy program. And they didn't come back because you're coming from far away. And they only had NHIF, which was paying walk in, walk out. But then the physiotherapy was expensive, 2,000, so they didn't do it. And in less than a year, they were actually in tremendous pain, and the joint had to be removed and a new one replaced quite after some time. So it's very, very important to note that this is a whole program. Right. Yeah. And even beyond that, there'll be some sessions, depending on patients, can go way longer than 3 months. Yeah.
Okay. Right. First question here. Hello, my dad-in-law, akona issue your arthritis. Kindly, where can we visit your doc? And in the hospital, do they take insurance?
So the first step you need is to have a proper evaluation by an orthopedic surgeon, and you'll end up having imaging such as MRI. And yes, at Dr. Asik Kantel Jaram, where I work, you're able to see orthopedic surgeons have an MRI done, a proper assessment. Okay. And then if there's need for surgery, then you'll be advised appropriately. Surgery is not automatic. Arthritis is, there is a lot that can be done before you get to the point of surgery. So that's to be clarified.
All right. And you'll definitely be sharing the contacts as we wrap it up. But before that, thank you, Stan. Kindly let Doc share home remedies if there are.
That is the other very important one. Now, the arthritis is so common that it's become a very big business for medical specialists. So a lot of people have spent lots of money, tens of thousands in a month, to try and get these supplements, and most of those don't work. Most of those don't work. So eat healthy, nutrition, foods that reduce inflammation, greens, nuts, that's what you want to eat. There's a conversation around turmeric, the spice. So normal spices, these are things you don't have to pay anybody for. But when someone comes to you with a green bottle that's labeled cures arthritis, please run. Generally, those things don't work. I really want to emphasize that, because people have paid collectively as a country probably in the region of billions to address this, and they don't work.
Right. Hi, morning. My question is, morning pain at the arc/heel.
So any time that you have any kind of pain in the joint, I'll repeat this again, pain is not normal, get checked. The heel in particular has a problem. This is not arthritis per se, but it's related. Where because the heel tends to touch the ground a lot, you can develop...
For wale wanashangai heel ni nini?
Kisigino.
Pale kwa mguu.
Ni kisigino. Sasa hapo kisigino, kwa maana unakanyaga chini kwa muda mrefu, inaweza kuna wakati ambapo kuna tuseme kapembe kanajitokeza. It's called a spur, calcaneal spur, that can be extremely painful. That's a different issue. Again, very easy to diagnose, and doctors can do something about it. It's can be quite problematic. So you always, whenever you have pain, give yourself, just get checked. We don't like going to hospital. Yeah. We should start doing that, because some of those pains can be even more serious than a calcaneal spur.
And speak of, because we have heel here, before we get your last words, just asking on behalf of all the ladies watching this morning, the high heels, for example. Yeah. How susceptible, because we've talked about posture, when you're sitting, when you're walking as well, and now when you're involving this, for example, does that mean that they would be more susceptible because of the posture of the heel and how they'd be standing, how they'd be walking, the high heel? For sure. And
you see, the body has its natural posture. So anything that changes the natural posture of the body, it creates an unplanned stress on a particular joint. Let me say the way you're manufactured, so I don't use the word, but the way you're made in a particular amazing way. I mentioned how effective your joints are to withstand hundreds of thousands of movements every year, and 70 years later you're still fine. We spoke about 50% above age 65 having arthritis, meaning another 50% despite the 65 years, the joints are still fine. Yes, they don't have osteoarthritis. So this is if you use the joint the way it was made to be done. But once you tilt a little bit more, apply undue pressure, then it changes the natural process, and that predisposes you to a lot more strain than you'd want.
Right. Doctor, even as you give us your contacts, someone has been listening to this, but then they're wondering, I still have more questions than the answers that I've gotten. What will be the takeaway home for them?
Okay, the takeaway home is arthritis is a pretty common issue. It affects many people. It will affect half of us invariably, and there is help. You don't have to suffer with it. You can actually reach out to us. Our website is jalarammedicalservices.org. Our contacts are on that site as well. You can reach out to me on social media at OVNGANI, OVNGANI. Visit us at Dr. Asik Kantere Jalaram Medical Services. And it's a pretty good place. Give us a call. We'll be able to assist you.
Your contact, maybe is kama itakuwa M-Pesa, just in case.
So for me, I think the bigger part is if for any service you require, I'll probably not be treating you personally. There'll be doctors who will be doing this at the facility. And I'm actually very happy to be sharing this knowledge with the public. So it's not more about the personal conversations. This is just to get the message out there. There's a lot we can do. Right. But if you really need help, please visit us at our facility. It's a pretty good place. And
speaking of help, there are still more questions coming in.
No problem.
That means people are really interested in all this conversation. First off, is there any relationship between arthritis and memory loss? The second one, I have been diagnosed of osteoarthritis. Recently, I met some doctors who came from India and prescribed surgery in India, not Kenya. Why should this happen?
Yeah, so I'll start with the second question. You have absolutely no reason to go to India for surgery. You have no reason to do that for any kind of knee surgery, any kind of arthritis surgery. There was a time in Kenya where we didn't have some equipment, we didn't have the expertise, but I'm telling you today, there is the number of things you need to go to India for has shrunken tremendously. The progress over the last 10 years, Stanley, not just in osteoarthritis care, is tremendous. And so be extremely careful.
The medical tourism has
reduced. And I should share this. There's the good side and the bad side of medical tourism. So there's a business. And so this business, businessmen would come to Kenya and they'll convince you to go back and get treatment. And it's not entirely indicated. So be very careful, fellow citizens. It's not as easy as it was. The landscape has become very murky and very muddy. There's need for increased regulation. but there is no reason for you to leave Kenya to go and get treatment. And in fact, for the possibility that you can get surgery, you can get a diagnosis to support the surgery that you don't need. So work a little bit with your Kenyan doctors, trust them more. And some of the best doctors in India now work in Kenya. Our own facility, we have probably, I think, 6 or 7 doctors who are some of the best in India already in Kenya. So you do not need to go to India anymore unless you have a proper conversation and your doctors tell you, and these are doctors you trust, 2 doctors, 3 doctors, you have to go to India for this. Right. Maybe if you're going for liver transplant or something, but some of the common procedures no longer necessary.
Right.
Yeah.
Thank you very much, Dr. Victor Ngani, Medical Director at Jalram Hospital, for having this conversation, for the wise tips you've given us, and all that. I hope we may learn a lot on this conversation here. Arthritis, trust here, Morning Cafe, giving you experts to dive into all these matters and help you understand what you really need to know on that. Something else that you need to know in case you're a parent right now or a future parent,